Good morning, everybody. I'd like to thank Pam and Nuala for inviting me to speak here today about how policy is driving the government's agenda in the approach of reducing obesity in Ireland. So over the last 40 years, worldwide obesity has trebled, and it continues to rise exponentially. The WHO report last year indicated that Ireland scored 9th out of 51 countries for obesity and 11th for overweight. What's even more shocking is that 60% of adults in Ireland are currently overweight, and 1 in 4 children are already overweight by the time they go to school. I think an even more alarming statistic is over the last 10 years, the level of overweight and obesity in teenagers has increased from 18% up to 24%. So we have a real problem on our hands. It's well recognised that obesity is a complex phenomenon born out of many factors, and these include genetic factors, environmental factors such as the environment that we live in, exposure to pollutants and exposure to marketing. The consequences of obesity are immense. In addition to musculoskeletal problems and reduction in quality of life, people living with obesity are at risk of heart disease, diabetes, and there are 13 different types of cancer that are linked with obesity. Stigma, social isolation, and mental health issues compound the effects of obesity and are often worse in those who are already living in socially deprived areas or are at the risk of social deprivation. Traditionally, healthcare has spent a large proportion of its budget on treating the symptoms of obesity, but evidence in the last 10 years is very supportive of tackling the root cause of obesity and working towards preventative measures in addition to offering treatment. So 10 years ago, the programme for government developed a framework to support a coordinated effort to promote physical and mental health well-being in the Irish population. The framework focuses on addressing health inequalities and changing the environment to enable individuals to make healthier choices, working with other government departments and building relationships with local authorities, private industry and voluntary organisations are critical to the success of the framework. So at the time, the government recognised that regulation of marketing of foods high in fat, sugar and salt to children was a priority. Ireland, in addition to 17 other member states with the European Commission, have pooled their expertise to develop tools and a framework to support member states under the Best Remap project, which is a shortened version of best practice in reformulation, marketing and procurement. Members of the task force in the FSAI with their academic partners, including UCC and the TUD, are supporting the project, which is due for completion in September of this year. The department will engage with the newly established Commission Naman around the online safety and media regulation bill based on the recommendations from Best Remap and take it forward as a priority. As you're probably aware and are very familiar with, there has been a number of food-related strategies that have been developed to ensure that Ireland can use a homegrown evidence base, if you pardon the pun, to support sustainable food production systems which offer healthy food options to their consumers. Providing nutritional information on products to educate people on what they are eating comes under the guise of front-of-pack labelling and is being directed by WHO and the EU Commission. Further research and industry engagement is required and is ongoing to support the implementation across the member states. Sláinte Care, the new Sláinte Care strategy is aimed at delivering services closer to home to those who most need them. The Healthy Communities programme is just one of those initiatives that has identified 19 different communities across the island of Ireland that do have high levels of social deprivation. It's in the process of recruiting 19 food and community nutrition workers who are going to work with the local authority and the local community to deliver initiatives that are relevant to their local needs, which would include the Healthy Food Made Easy programme and initiatives around parenting supports. So the Obesity Policy and Action Plan is a 10-year strategy which outlines a 10-point action plan, and it was developed back in 2016. The Department of Health and the Health and Wellbeing Programme chairs the Oversight Group, or OPIOG as it's otherwise known, to monitor the progress of this action plan. It's a cross-sectorial initiative, so it involves working with lots of other government agencies or government departments, and one such initiative would be working with the Department of Finance on the sugar-sweetened tax that was introduced back in 2018. An impact evaluation report from this initiative is expected later this year. The department have also been working with the Department of Education and the Department of Agriculture to improve education in schools with the Food Dudes and the Incredible Edibles initiatives, so that children can learn about healthy eating and where their food comes from. Last year, the OPIOG reviewed the implementation of the OPAP in line with the WHO report to determine how much progress was made, which in parallel to the WHO report, there are a number of initiatives that have been implemented either fully or to some extent, but there are others that still need to be worked on. Some examples of this would be the breastfeeding strategy, which has resulted in an uplift in the number of lactation consultants that are available around the country to support new mums in their breastfeeding journey. You will notice that, park runs, outdoor exercise equipment, and cycle lanes are popping up all over the country due to the resource that's been invested through the National Physical Activity Plan, and the new plan is in train to be developed. I've already mentioned about the Best Remap project, but also we've been working with the Department of Social Protection about nutritional standards for the provision of school lunches to originally DESH schools, but that has resulted in further rollout across the country. We have worked with your colleagues in the FSAI about developing scientific recommendations for various population groups. So we've got recommendations for the 1 to 4-year-olds, the over 65-year-olds, and vitamin D. And then we have subsequently worked with HSE and Safe Food to develop public resources. So evidence from systematic reviews would demonstrate that nutritional intake can be improved with reformulation of commonly consumed foods, and it's called out as a key strategy in the OPAP to contribute to the overall reduction in obesity. We know from the food consumption surveys that are conducted through the Irish Universities Alliance that staple foods in the Irish diet include things like processed meats, bread, potatoes, cereal products, and dairy foods. And we know from the surveys that in all age groups, the consumption of fat, sugar, salt is higher than the recommended nutrient intakes. Unfortunately, the intake of fruit and vegetables and correspondingly fibre is much lower than the recommended amounts. What we also know from the surveys is that after the age of 1, the consumption in children increases of biscuits, cakes, and tends to continue to increase throughout childhood. And one of the more shocking statistics is that 20% of energy intake in teenagers comes from the top shelf, and these foods are ideally supposed to be eaten sparingly. 24% of all food in adults is eaten outside of the home, and some of the barriers to healthier eating are considered to be time and convenience. And for this reason, the Healthy Weight campaign was launched last year by the Health and Wellbeing Programme to raise awareness in the younger adult population. The stark increase from the end of your teenage years into adulthood is a real risk time for developing obesity. So it factors on things like stress, management, sleep, healthier eating, ability to do exercise, and so forth. So food reformulation. So under OPIOG, a subgroup was established and was chaired by Professor Ivan Perry, who comes from University of Cork, and they developed a strategy and the roadmap to develop food reformulation in Ireland. And in liaison with the Department of Health, we're able to secure dedicated funding to take this forward for a project that's due to last for the next 4 years to tackle the target nutrients that we've already mentioned. The task force are here today, and they are currently working on this programme with you as the industry partners, but also with their academic partners and their EU colleagues. So I think this is a good time now to hand over to those with more expertise to go into more detail about the task force and talk about the practical issues that are relevant to implementing this initiative. Thank you for your time.